Only good thing I know is a little bit of red wine is good for your heart. But
Okay, for real.
and I think for physical health, as I said, avoid ultra processed food.
Which is?
Anything that comes from packets.
Okay. What does the next decade look like for India's healthcare and also especially women's healthcare?
You'll be surprised that now the Royal College of Obstetricians in the UK has there's an article on the benefits of ashwagandha, of magnesium, things like that.
What about alcohol and cigarettes? Like, how dangerous are they, or can you have it in a limited quantity? Hi. So today I am sitting down with Dr. Sujata Datta, and we'll be talking about one of the most important and global health issues right now, cervical cancer. Hi doctor, welcome
Hi.
to the show. How do you feel?
Good, nice to be here.
So
Lovely afternoon.
you like the surroundings?
Yes,
Yeah.
lots of green, so very refreshing.
Awesome. So we'll get straight to the point.
Yeah.
For everyone out there, who are perhaps not aware or not maybe fully aware, what exactly is cervical cancer?
So cervical cancer is cancer of the neck of the womb. It's a very important cancer for women, and we talk about it because it's the only preventable cancer in women. You know, cancer is very common, but in most cases you can't really do anything about it. But this is one which we can take steps to prevent, and it affects women in their 40s, 50s, up to 70s. Although the start of it is much earlier. So it's important to talk about it because we know that all over the world annually about 3.5 lakh people die of cervical cancer every year. So it's an important health problem, and because it's preventable, we can take steps to make sure that people don't get it.
Right. So is it one of the most common types of cancer?
The commonest cancer in women is breast cancer.
Right, obviously,
But
yes.
after that, it's cervical cancer.
Okay.
With breast cancer, you can't prevent it.
Right.
You can screen for it, but you can't prevent it.
Okay.
But cervical cancer can be prevented, and it's the second most common cancer in women, so an important one to discuss.
And why is it known as the silent killer?
A silent killer because it doesn't give you any symptoms. So when my patients ask me, what should we be looking out for? How do I know that I have cervical cancer or that I might get cervical cancer? That's just the thing. There aren't any symptoms.
Okay.
So you can get an infection
Okay.
from human papillomavirus, which is acquired through sexual contact.
Okay.
And then over a period of the next 5-10 years, that virus may persist in the body and cause some silent changes in the cervix.
Right.
And these are precancerous changes.
Okay.
During that period, there aren't any symptoms. And you actually have to investigate and do tests to see if you've got the infection and if it's causing any changes in the cervix, precancerous changes, that is. And
so, just to cut you,
yeah.
So you mean to say for about 8 to 10 years, you might have the virus in you and you might have no symptoms at all?
You wouldn't have a clue. And that's why it's called silent, because by the time it makes its presence known, it's already quite late, and you might get irregular bleeding, pain after sex, bleeding after sex, but by then it's almost already too late to prevent it because cervical cancer has happened. And as you know, I've told you 3.5 lakhs women die of it every year. So it is a silent killer, a big one. And it's much better. Prevention, is better than cure. So it's much better to address it before it's happened.
Right. So the number that you're giving me, is it like a global number?
That is the global number.
That is the global number.
Yes. And it's a global number, but unfortunately, most of the fatalities happen in low and middle income countries. So we contribute a lot towards that number because of lack of awareness and lack of a national program. So it's not, it's not built into our health system, and it's down to programs like yours and patient awareness, people awareness to try and go forward and ask for help. Whereas in the higher income countries, they have a system built in where the government would call all women who are eligible for the tests
Right,
at a
right,
particular time,
right.
and the government makes sure that it's done from time to time on a regular basis so that it can be picked up and prevented.
All right. So, in terms, do you think India is well equipped to deal with cervical cancer, or is it too premature?
No, it's a major health problem. And the good thing is that more and more people are becoming aware
Right.
of this.
Of course, yes.
Vaccination has come in.
Hmm.
So once the vaccines have come in, then there is something definite that we can do about it. And more people are becoming aware. We are hoping that the government would make note of this, and already the process has started.
Right.
And it's being percolated to the masses, and young girls are asked to come forward and have their vaccination. Um, of course, the burden is huge and it'll take time, but I think we are taking baby steps in the right direction.
Right. In terms of say polio, there was this huge campaign which was rolled out by the government of India back in the day, that polio drops and all of that. Do boon zindagi ki, something, that was the slogan. Why isn't the HPV vaccine also as, maybe, it's not as massy a campaign as the polio, or why has it not been percolated down to every women?
So that's a good question. I think primarily it's because there wasn't a vaccine that was so readily available in India.
All right.
There is an international, a multinational vaccine which has been around for 15, 20 years now, but it was available in countries outside of India. Cost was an issue because each dose cost quite a lot, and it wasn't possible for the masses to actually make use of it. The good news is that one of the institutes in India has come up with an indigenous vaccine,
Okay.
which has actually decreased the price significantly.
Right.
And once now that it's available, the government will take note of it, and they've already talked about rolling it out to those who are eligible in the government sector as well, which should be coming in quite soon.
Right. So you mentioned about the price point. So
Yeah.
what is basically the price point for a vaccine, and how is it generally given? Like, what are the dosage, or what number of times?
So first we have to know who should take it. So this is a vaccine that should be taken by young girls, and the license is from 9 years to 45 years. But it's best taken at 12, 13, up to say 25 years.
Oh, that early.
That early. And why is that? Because HPV virus is acquired through sexual contact, through intimate skin to skin contact.
Right.
So this is the age group where people actually become sexually active. And the more number of partners you have, the more times you have sex, the earlier the age of first sexual activity, the more you are at risk of acquiring it from somebody who already has it. So the ideal time to give the vaccine is before the first sexual contact.
Okay.
And that may be in other countries 13, 14 years.
Right.
In our country, it might be a little later. It might even be 25, 26 years. But it's best taken before the first sexual contact, because then the vaccine arms you with these little chemicals in the body called antibodies. And it's like an army of soldiers. So if later you have contact with somebody who has HPV, the body will detect that it's that foreign antigen that's trying to get into to the body, and all the soldiers will then go and attack it and kill it off, so that you don't get the infection in the first place.
Right.
And because that's the mechanism, it's important to remember that it should be taken early, before anything starts happening in terms of intimate contact. It's also important to understand that this is not a vaccine that will treat the infection if you've already acquired it.
It's like a preventable thing.
That's it. So therefore, if you give it when you're much older, if you've already had this contact and you've acquired the virus and you're 35, 36, you can take it, but it's not going to be as effective.
Right. So is sexual activity the only way in one in which one can get the virus, or
It is the one way which you get it through, and various types of sexual contact.
okay,
So therefore and it shows in the areas where you can get an HPV related cancer. So in women it's cervical cancer, it could be vaginal cancer, vulval cancer. In men it can happen in men as well. Penile cancers can happen from the same HPV vaccine, and in some of the countries they're now bringing in vaccination for men as well, for
okay,
boys,
okay,
again before
okay,
contact. So
right, okay,
it's a gender neutral vaccine. That is what's coming in all over the world. And also oropharyngeal, so it sort of reflects the different ways in which sexual activity could happen.
okay.
um, so that's really more or less in a nutshell how it's transmitted. And what was the other question?
I kind of also messed it up.
Yeah.
But to take this point, so it's not just sexual intercourse, but it's other all the different kinds
All
of sexual.
intimate contact,
So if
yes.
suppose one person is using a condom, so that's not the only way to prevent.
So condom is a very good way of preventing it because it prevents skin to skin
Right,
contact, and
right,
as I
right,
said,
right,
it's intimate skin to
right,
skin
right.
contact. So it's a very important way of prevention, and certainly before anybody's in a monogamous relationship long term, condom should be encouraged because it not only prevents HPV, there are also other sexually transmitted
Yes,
infections
obviously,
as well,
obviously,
which
obviously.
can cause infertility, etc.
Right.
If not cervical cancer, there are other things that can affect women, and barrier protection is a wonderful way of preventing all of those problems.
Right.
Regarding doses, so if you take it early, below the age of 14, then 2 doses suffice.
Okay.
6 months apart.
Okay.
But above the age of 14, it's usually 3 doses. So
Okay.
1 dose is now, 1 in a couple of months, and 1 6 months later.
Okay. Okay.
So it does involve a few number of doses. But medicine is a changing science, and people keep trying to make it better and better. So there's a lot of research that's going on in France and UK, and they are coming up with this idea that actually even one shot in young girls and boys might be enough.
Okay.
If you have
Right.
a
Right.
vaccine that covers most of these serotypes that cause cancer.
Right.
So human papillomavirus, it has lots of substrains. That's the name of the vaccine, but there are lots of different strains, not all of which cause cancer.
Okay.
But there are about
Okay.
12 high-risk subtypes that will cause cancer. And the Indian vaccine covers 2 of those subtypes, 16 and 18. And that is what accounts for 70% of the cervical cancers.
Right. Right.
But then there are other ones, the international ones, which cover 9 kinds, 9 out of 12. And so the prevention and the coverage is even better for those.
So the indigenous vaccine that you mentioned, what is like the efficacy of this vaccine?
So people who've actually been vaccinated, it's extremely good, 98, 99% coverage. But if you get an infection with another subtype,
obviously that's not covered. Yeah, that's not covered. Correct.
So
Correct.
therefore those wouldn't, but 16 and 18 are the ones that cause the most cancer.
Right. And how does one detect that you have the cancer? What is the way to detect it?
Yeah. So before we detect cancer, what we suggest that our women do is come for a very simple test called an human papillomavirus detection swab.
Okay.
And
okay.
a pap smear.
Right.
So these are the 2 things for screening. So if you do a swab and you don't have the virus, then you know that you're not going to get cancer because you don't have the infection. If you have the virus, then you do this cervical cancer screening, which is a pap smear, where we know that the abnormal cells or the precancerous cells are there in the vaginal fluid because it's shed from the cervix. The cervix sits in the vagina, on the top of the vagina. So those abnormal cells would be shed in the fluid of the vagina, and we can collect that fluid with a brush and test it under a microscope to see if the abnormal cells are there.
Right.
So these 2 tests would help us have a very good idea about who will and who won't
Okay.
get the
Right.
who is at risk for cervical cancer. So if
Right.
all the tests are clear,
Right.
then you don't worry about it. You just come in another 5 years and have the test done. So it's every 5 years till the age of 65, starting age 25. After you've been sexually active for 1 year, that's when you should start having the screening tests.
Okay.
And if you have it, if you have the HPV infection on the swab and it shows abnormal cells on the pap smear, then we do a third test, which is called a colposcopy.
Okay.
So, what we do is we put some dye on the cervix, Lugol's iodine and acetic acid, two different kinds of chemicals, and then we look at the cervix with a magnifying device, like a magnifying glass at the end of a camera, and it shows us the architecture of the cervix, what it looks like. Is there any area that looks abnormal? If so, we take biopsies from that. The biopsies will tell us if there are precancerous changes.
Okay. Right.
Because if there are precancerous changes, then we can treat that area. We don't need to remove the whole uterus, because these are sometimes younger women who would want to go ahead and have children and they haven't completed their families. So we wouldn't remove the whole uterus. If we catch it nice and early at this precancerous stage, we can just take a little sliver of cervix off where the precancerous changes are, and that treats the problem and prevents it from becoming cancer in future.
Right.
Unfortunately, if somebody skipped all of these and hasn't had any screening and unfortunately starts getting bleeding and pain, and then we do an examination and we see this fungating growth with foul smelling discharge, and we suspecting cancer, then again we have to take biopsies from that, check whether there's a cancerous growth, and then depending on the stage, and we do MRI scans and PET scans to see how far it's spread, and depending on all of that, the treatment would either be surgery if it's early stage, or radiotherapy, sometimes chemotherapy.
Right.
So that's a much more technical discussion
Right.
about cancer.
And what is the cost of this vaccine? That was the question which I forgot.
Yes.
Yeah.
So the foreign ones, the multinational ones are slightly expensive for our population, but it's because of a reason, because it covers 9.
Right.
And we have data about it, because in Nordic countries it's been followed, and everybody who's been vaccinated goes on a register, and they followed up all of these women and they've seen that there's no breakthrough case of cancer. So they've got data about the efficacy of the vaccine, and therefore it is expensive. It's upwards of 10,000 per shot.
Per shot, and you have to take 2 shots.
You have to take 2 if you're young. If you're older, then 3 shots. But as I said, in France, there's a lot of research going on, and in England, they've moved to a single shot. So 1 dose if you're below 20.
And what about the
The Indian vaccine is a lot cheaper, and it's somewhere between 2 and 2,500 per shot. So it's a lot more accessible for our age group. And coming back to your question, why hadn't this become part of our national vaccination program? Now that we have a vaccine, and it's very recent, it's just coming in. Now that we have a vaccine that can be rolled out to the masses and the young girls of our country without it being too much of a financial burden to the individual or the government, then I'm sure it's going to come in, and there are big plans about rolling it out.
Right. So, doctor, you mentioned that, once when the government intervenes as well and it becomes a nationwide campaign, that time the cost of the vaccine will go down, or perhaps it will be accessible to every strata of the society. Now, here's my question. Why is it that despite India being one of the biggest economies of the world, still, when it comes to health for all or the equality, we are far from even being close to what should be?
And that's a question that I think it's multifactorial, really. We can't really put the blame in one corner, because it's awareness of the masses, it's lack of education, it's poverty to some extent, and in the remote areas, access to infrastructure, to healthcare, all of this. Um, so if you don't have access to basic health care, then how are you going to even think about preventive medicine?
Right.
Because people are so caught up with their day-to-day livelihoods, working to try and have a some degree of comfort of in their day-to-day lives, and then if they fall ill, that's when they go to doctors. Very few people in the villages will actually think of preventive health and go before to a doctor before anything's happened, and that's because of lack of reach, I think, in the remote areas. But even in cities like, I mean, we're in Kolkata, even in cities, there's a lot of misinformation and I would say a lot of myths surrounding vaccinations, for instance.
Right.
Often there'll be people, they'll come and say, oh, if I take the vaccine, will I become infertile? There's a lot of suspicion, and it comes from lack of awareness, lack of education and knowledge about it. So I think your podcast will help a lot of these women and tell them, look, it's a good thing, it's to save your life, and nothing bad will come of it. The side effects are minimal, it's just a small injection. You can get a bit of local pain, one day a little bit of cold compress will put it right, but there's no major ill effect. You won't have syncope, you won't have any major neurological problems or infertility. So I think that is one thing, fear. So even if it's accessible, people don't want to take it because of the fear of something else going wrong. So improvement in education, access to healthcare, financial burden. So if the price comes down and the government rolls it out,
Right.
then people don't have to worry about it, and they would then happily take it. And I think it should be fed into the like when the babies are born, they a lot of these vaccines are given at birth, and as they
Yeah.
grow
Yes.
older,
Yes.
so it
Yes.
gets into a vaccination schedule
Exactly.
that's universal. And although you can't give it at birth, you can
Hmm.
start giving it from 12, 13.
Right.
So
And
if
that
it
is
gets
also a
built
time when a
in,
lot of vaccines are generally given to
given as
children.
well, the
Yes.
the
Yes.
catch up vaccine or top up,
Yes.
whatever they're called. And then if it's built in, I think it'll remarkably reduce the load of disease in our country, because the WHO recommendation is, or their target is, eradication of cervical cancer by 2030. And
Do you think that's a actual
to
person?
achieve that, you need to vaccinate at least 70% of eligible girls all over the world.
Okay.
70% should be
Right.
vaccinated.
Right.
And early treatment of 70%
Hmm.
should happen.
So, you mentioned the fertility thing. A lot of women are perhaps scared, or perhaps they don't know whether this vaccine will actually hamper their fertility.
Fertility, yeah.
Now, also moving to a different direction, there are a lot of women who, right now, in today's time, are choosing not to be mothers. They're choosing not to have a baby, perhaps just stay without a baby, perhaps adopt or do something else. Um, does having a baby or not having a baby impact one's vaginal health or overall body health, especially like obviously in women?
So if you're talking specifically about cervical cancer,
I'm also talking in general.
yeah. So cervical cancer, no, because it's related to sexual activity, whether you have babies or not.
Right. Okay.
But if you are talking about breast cancer, for instance, then having children, breastfeeding is protective. So if you
Okay.
breastfeed and you have children, then it decreases the chance of getting breast cancer.
Okay.
So in that sense, it is related to overall cancer reduction, if you have babies.
And what about the overall health? Does it impact, or there's not major change in one's overall health?
So
Not just cancer related.
that is very individualistic. Mentally, you have to be ready to start a family. Financially, a lot of people feel that they need to be on stable ground before they think of starting a family, because it is expensive to bring up a child now. And if you've put on weight, you can have problems getting pregnant. But again, if you have a baby and you're breastfeeding and you're eating right, you're exercising, then you lose weight, and that decreases a lot of problems such as cardiovascular diseases, high blood pressure, diabetes, all of that. But it's not just one thing. It's not just if I have a baby, then I'll have this, or if I don't have a
Hmm.
baby, then I'll have
Hmm.
that. It's not that straightforward. But it's overall health, overall healthy living, including diet, including exercise, and mainly making sure that you don't put on excessive weight.
Hmm.
That will reduce your chance of cardiovascular diseases, high blood pressure, diabetes, and some cancers.
So if you have to recommend, like, this is again coming, oh, I'm asking this only for all the women out there. If you have to recommend in 2026, living in India, where the AQIs are not always favorable to us. Uh, there's a lot of dirt and pollution. There's overpopulation as well. So if you have to recommend healthy living, what are the 3 tips that you would give to all the women out there living in a country like India?
Hmm. I think for physical health, as I said, avoid ultra processed food.
Which is
Anything that comes from packets.
okay. Okay.
So fresh food, fresh fruits and vegetables, grains, whole grains. If you cook with whatever our food is, roti is fine, but avoid pastas and pizzas and things that you can buy from shops that are already baked, because that's sodas, cold drinks and things like that. It's got a lot of sweet. So anything that's got sugar is really bad for you, because that is what causes all of these things in the long run. So fresh food that's not ultra processed, that is what you should be eating, including 5 portions of fruits and vegetables a day. You should be
5 portions.
Yeah, fruits
Okay.
and
Okay.
vegetables. You should be
That's a lot.
exercising. It's not a
That's
lot. I
not a
mean,
lot.
if you think about what you're eating through the day,
Okay.
including
Perhaps.
your, lunch and dinner, you
Right.
will have some greens. You
Right.
could have if you actually think about it, we probably have less than we ought to, but most people have at least 2 or 3.
Okay.
Sabzi to khate hi hain.
हाँ तो वो 5 मैंने सुना ना तो मैं थोड़ा अच्छा ठीक है और
But
नेक्स्ट
that is the recommendation.
ओके ओके
Exercise, again, very important for overall health. The recommendation is 150 minutes a week. Okay.
Okay, that's not
So
much.
that's not much. If it amounts to about half an hour a day, and if you can
Correct.
build in strength training, especially for the older women over the age of 35, 40, a bit of strength training with weights or resistance, even with yoga and all of that, that's very good for your bone health, and prevents, in the old age, it prevents falls and fractures, which is a major cause of morbidity. And of course, mental health is very important, isn't it, in today's
Obviously,
age? So
obviously.
you have to have some time for yourself, some me time to just unwind and do what you want to do, whatever relaxes you. It could be a hobby, it could be playing cricket, football, it could be music, it could be reading a book or art, doesn't matter. But you have to have some unwinding time. Otherwise, and don't carry work back home. So these are my 3 tips for 2026.
I think, and that's also, I think, pretty much gender neutral as well, I would say, all the
Absolutely,
things that you do.
absolutely.
And what about alcohol and cigarettes? Like, how dangerous are they? Or can you have it in a limited quantity? If alcohol and cigarettes, maybe one
So
or two.
cigarettes, cigars, all of it, you really should be shunning, because it does so much harm. Almost every cancer you can think of, not only lung cancer, has some sort of relationship with smoking.
Okay.
In pregnancy, it's really bad because it can hamper blood flow to the baby and cause growth restriction. So smoking definitely should be avoided as much as possible. And not only active smoking, also passive smoking, because if you're smoking in a room, there are other people who are now having to inhale your smoke.
Obviously. Yes.
So that should be kept in mind for those people who smoke. Alcohol, again, there are recommendations for men and women, and 1 to 2 units a week is acceptable. But if you're pregnant, then you should be really not having it, because there is something called fetal alcohol syndrome, where you can have facial deformities, heart problems, growth problems, and IQ level will also be depressed.
Right.
So definitely not in pregnancy. Otherwise, 1 to 2 units a week is acceptable.
So when you say acceptable, now I have seen a few reels here and there, and coming from the social media knowledge, they say that if you have say, अगर आपने रम पी लिया तो आपका सर्दी चला जाता है, फिर एक दो ऐसे और है, ये विस्की पी लिया तो किडनी साफ हो जाता है, एक दो पेग अगेन, as you said. Is it a real thing or is it just?
Well, the only good thing I know is a little bit of red wine is good for your heart. But
Okay, for
sardi
real.
and yeah.
Okay.
If you have it, in moderation,
Okay.
it's supposed to be good for your heart. But all the rest of it,
हाँ.
I think.
And rum से सर्दी खांसी नहीं जाती है.
I've not come across
Okay,
it.
so that's
really.
the breaking the myth out there. So what does, my concluding question will be, what does the next decade look like for India's healthcare, uh, and also especially women's healthcare? Or you can address both the questions.
Yeah. I think initially after independence we were really rock bottom in the pits.
Right.
But as awareness has increased and we are beginning to rely on ourselves and the knowledge has become better, and there's a lot of globalization as well that's happened. I mean, we're going the other way now, but in the last few decades, there has been a lot of globalization and interaction and exchange of information, which has enriched all of us. And that's gone out to even yoga. It's everybody's all over the
Yes,
world
all over the world,
practicing
yes.
it. You'll be surprised that now the Royal College of obstetricians in the UK has there's an article on the benefits of ashwagandha, of magnesium, things like that, things that ashwagandha we've used for a long time without it coming into mainstream and Ayurveda, and a lot of these micronutrients people are talking about now. And it's information and knowledge has gone out from our country, and we've assimilated information from other countries, and we know what's good for us. And I think in a systematic way things are looking up, knowledge is increasing, and I think the social media actually has had a lot to do with people's increase in people's knowledge and awareness, because not everybody was able to read at one time, but
Right.
everyone knows
Right.
how to hear, listen, and understand. So that has, and the podcasts and programs on different kind of media has help percolate this information through the masses, and a lot more most people are now a lot more aware, interested in their own health, and looking at not only treating problems but also preventive health.
Right.
So I think we're really quite good at building up on what we've got, and I'm very hopeful that in the near future we will be right up there with the rest of the countries. It takes time. These things can't happen in one day. But
Right.
once the infrastructure is put in place and the systems put in place, and if there are guidelines that everybody follows and standardization of care, I think that's very important. You should be able to go to a doctor in any part of the country and get the same treatment everywhere.
Correct.
And that can only happen with guidelines and standardization.
Correct.
And as long as we follow those guidelines, then we should be good.
So, from a very personal point of view, do you think India has done well over the last 75 odd years from where its healthcare was after independence to where it is today? Or do you think it could have done better? Or do you think it has exceeded its expectations?
I think it's done well, because there's the National Health Commission and the central government. They have these different schemes where they focus on different areas of health for women, for children, and the maternal mortality, how many women die from childbirth, and infant mortality. All of that has come down remarkably from where we started off,
Right,
just
right,
after
right.
independence to now. The doctor-patient ratio has increased. Before, there used to be really very few doctors, but now the government has made sure that there are more medical colleges, there are more medical seats, most postgraduate seats, and so the doctor-patient ratio has increased. So more nurses, more doctors, more infrastructure where primary health centers are set up. Vaccination is one of the success stories of our country, really, because you have these workers going from home to home, even in the remote areas, giving pregnant women vaccination,
Right,
giving
yes.
children vaccination, and that's how polio eradication has happened.
Right,
That's how malaria, they're working on it. Smallpox has been eradicated. So there
Right.
are lots and lots of success stories, and we're definitely on the way to success.
Right. Thank you so much, Dr. Sujata, for coming down, and wishing you all the best. And thank you
Thank
so
you.
much for giving your time.
Thank you. It's been a pleasure talking to you.
Thank you.